Welcome to Chapter 11. This is physical and chemical agents of control. So this is explaining how we know how to get rid of certain microbes in certain environments. So if you were to flip over the Clorox bottle, it actually tells you different dilutions for different sorts of levels of contamination. So when we think about controlling microorganisms, the various microorganisms that we're going to try to control are things like yeast, which could cause spoilage, worms, viruses, prions, all these things that you've learned throughout the semester. And so the chemical and physical agents are literally trying to attack something that the microbe needs to be able to survive. And so the resistance of microbes varies greatly, and I think you'll find surprising that envelope viruses such as the flu virus is actually a least resistant microbe. And so I always kind of crack up when I see kills, 99.8% of all viruses, including the flu virus. And I'm like, well, that's great, but the flu virus is actually not very hard to kill. What you really need for a sterilant is to be able to kill bacterial endospores. And so the microbes that cause disease in the clinic, things like Pseudomonas that can contaminate machines, Staph aureus, the causative agent of MRSA, these are in the moderate range. And so we have different techniques that we're going to kind of explore to sterilize or, reduce the quantity of microbes on a inanimate surface. And so one of the major ideas of resistance with endospores, so endospores are actually a really big reason why we have to use an autoclave to sterilize metal equipment. So we'll talk about the autoclave further in just a moment. But essentially the deal is these guys are so resistant to heat, to, water pressure, sporocidals, you've got to leave it on there for 3 hours. And so these guys are significantly more resistant than that of their vegetative form. So think back to Bacillus anthracis, Clostridium perfringens. The reason that they are so difficult for us to get rid of is because they form endospores, and so we have to go to extreme measures to remove them from where they are contaminating. So sterilization is the removal of all microbes, and let me reiterate, all microbes from a surface. And so we could never sterilize our bodies. We sterilize metal equipment that can withstand high quantities of heat and pressure. Disinfection, this is what we typically do to kind of clean countertops, to clean, basic level interactions with patients. So you will disinfect the bed that a patient sits on. And what it will do, it will get rid of the vegetative cells, but it will not get rid of endospores. Antiseptic, this probably reminds you of the antiseptics that you maybe do with mouthwash. And so this is applied directly to your skin, so bodily surfaces. So antiseptics are things such as mouthwash, betadine, alcohol in low quantities that you put in hand sanitizers. Those are all antiseptics. And then sanitation, to be able to distinguish sanitation from disinfection, you have to think about the fact that sanitation is actually just the mechanical rubbing to remove a microbe. So you could sanitize your hands using water, because technically the water is just flushing off the microbes. Disinfection is when you're actually using a chemical to destroy the microbe, not just remove them from the cellular surface. And so the factors that control how long we treat a specific microbial contamination is dependent on quantity, right? So if you have gone and played in the mud and you stomped in one mud puddle versus, you rolled around in the mud, there's a big difference. So same sort of idea when it comes to microbes. When you think of the nature of the microbes, so these microbes vary based on whether or not they have endospores, whether or not they're an envelope virus versus a naked virus, and so those sorts of things make a difference on how difficult it is to kill it. Temperature and pH, so similar to proteins are susceptible to temperature and pH, well, bacteria have proteins, and as a consequence they are then inhibited through unhabitable temperatures or pHs. Concentration or dosage, so when you think about how much of a chemical that you're exposing the microbe to, that makes a difference. You know, very small amounts are not as toxic as, you know, larger quantities or saturation of the chemical. Mode of action, so is it targeting the cell wall synthesis? Is it targeting the cell membrane? Those sorts of things. And of course, other distinct solvents, organic matters, or inhibitors can alter the way that that specific disinfectant will work. And so these are graphs just kind of illustrating those points. And so time of exposure, so if you think about if you're scrubbing microbes and you're trying to get that clean, well, if you clean for 2 minutes, right, like with a hand washing assay, you're going to find that you still have quite a bit of microbes on your skin versus if you were to scrub for a longer period of time. So not terribly surprising. But of course, this is sterilization, so you must be interacting with some sort of inanimate object. This does not apply to your skin. The microbial load, so if you are very, very dirty, if you have a high level of contamination, you're going to find that it's going to take you longer to clean it, so very logical. The presence of spores. Spores require that you will have to expose that particular microbe to heat or pressure for longer periods of time or higher temperatures to get rid of them. And then the type of agent. So we're going to talk about 2 major agents in this chapter, microbial static and microbial cytal. Microbial static, so if you think of being in stasis, that is something that is going to pause the growth. It's not going to kill the microbe, but it's going to pause the growth of that microbe. Microbial cytal, this is going to kill the microbe, and so you can see here the number of viable cells goes down and actually reaches 0, versus here the agent's added. The cells are still capable of growth, they're just not continuing to grow, so they're not going in an upward fashion. And so relative practical concerns are, you know, what are you using the object for? You know, you can't take plastic or at least you can't take certain plastics and expose them to 121 degrees Celsius. They'll melt. So some items, you know, must be reused because of cost, so we typically have metal tools in the clinic. And so those items are reused and they are able to be sterilized in an autoclave. And so these are just very logical questions and concerns for you to consider. So the specific targets of the microbe include cell wall and cell membrane. So the cell wall is consistent of peptidoglycan. If you're a gram-negative bacteria, you've got an outer wall of lipopolysaccharides. So these are the types of targets that would be interacted with detergents or various alcohols. The cell membrane. The image of the cell membrane is shown here to the right, so you can see that if you have certain surfactants or certain detergents that are used to treat the cell membrane, those detergents actually push their way through the phospholipid bilayer, and they're actually pushing across the phospholipid head, and so they cause those phospholipids to lose interaction, and then as a consequence you lose your cellular membrane integrity. Protein and nucleic acid synthesis. So the construction of proteins and nucleic acids is critical for the metabolism of the cell, replication, transcription. All of these processes are necessary. And so if you stop the replication, you in turn then stop all protein synthesis. Proteins themselves, so there are some that don't impact the synthesis process, but instead will cause the protein to denature. And so examples of that you can see here. pH and heat will cause a complete denaturization. In some cases, small amounts of pH and heat will just cause, you know, a shape change, so that then the active site of the enzyme is no longer functional. Or then you can have things like heavy metals that can block or bind the active site as competitive inhibitors. So if you wipe your hands with an antimicrobial cleaner, you're doing which process? The best answer is antisepsis. And the reason is because your hands are involved, so it's a bodily surface. The methods of physical control that we're going to talk about first, this is just the overall summary, so heat, cold temperatures, desiccation, radiation, and filtration. When we compare both moist heat and dry heat, what you find is that moist heat is going to require lower temperatures and shorter exposure time. So moist heat is much more effective when you are short on time to sterilize something. So often parents will boil baby bottles, for example. And so dry heat, however, goes to such high temperatures, there's a lot of various surfaces that cannot be exposed to dry heat. So dry heat are things like a bacterial incinerator that you use to sterilize an inoculating loop if you were doing this class on ground. So when we compare those, you can see here as the temperature goes up, the quantity of time needed to sterilize using moist heat goes down. And that is true also for dry heat. But in particular, notice here that at 121 degrees Celsius, it only takes 15 minutes to completely sterilize, remove all microbes from that surface. Versus with dry heat, you're going to have to go for 600 minutes. So a significant difference between these two methods, which is why in the clinic we often use things like an autoclave to disinfect our various equipment and things like that. And so steam under pressure is the autoclave. It is 15 pounds per square inch at 121 degrees Celsius. We usually vary that between 10 and 40 minutes. And so the steam must be able to reach all parts of the surface for it to be sterilized. And of course what happens is all the proteins are denatured. There's complete destruction of the DNA. Boiling is another way that you can do a steam or moist method of disinfection. And so steam from boiling, right, you're looking at about 100 degrees Celsius. You're going to do that sometimes for as long as 30 minutes before you're going to be able to get rid of spore-forming pathogens. Thermal death measurements, a way to calculate how quickly or how long it's going to take a person to treat a contaminated microbial sample. You can do thermal death time. So thermal death time is the shortest length of time required to kill all test microbes. And so this type of problem will have a variable of time and a constant of temperature. So an example of this would be sample A was heated at 80 degrees Celsius for 3 hours. When was the sample sterile? Versus thermal death point is when you're trying to figure out what is the lowest temperature you could use to clean that sample. So designing and answering these problems will be your discussion board for Module 4. Dry heat, shown here, this is a bacterial incinerator, so if you'd taken this as an on-ground class, you probably would have been using a metal inoculating loop instead of the plastic ones. And so this interior area actually gets very, very hot. You can see it's flame red. And so it's used to sterilize that inoculating loop and allowed for then you to transfer specimens. We can also remove contaminants by incineration. So you actually burn things to break them down, and this happens a lot with biohazard type samples. And then of course there's dry ovens so that you can put things in and coagulate proteins and make that safe for disposal. So pasteurization, you can see here that we consume various pasteurized products. Your milks, cheeses, yogurts, most of the things that you encounter today, for dairy especially, have been pasteurized. And essentially the purpose is to remove any type of contaminants that could cause harm to humans, as well as remove agents that cause spoilage. So you'll see that sometimes you encounter things that are not just pasteurized, but it's also called ultra pasteurized. And so that is when you've extended that process, so then there's a much longer shelf life on that product. So for example, Horizon milk is typically ultra pasteurized. You can see here that the batch method, so you can do a lower temperature for 30 minutes, or you could do a flash method, so you're going to a higher temperature for only 15 seconds. This is not sterilization, because if it was, you would not have those probiotics found in your yogurts and these sorts of products. And so the risk is that this doesn't kill endospores, and if there is some sort of contaminant, then that could be of a concern for the community. Ways that we reduce microbes are by using microbial static agents such as the refrigerator or freezer. So these allow us to preserve our food for longer periods of time. Desiccation and dehydration. So often in the clinic, most of the vaccines or treatments that you get are going to be in a lyophilized vial. So these things have been freeze-dried. All of the water has been removed. And so once the solution is added back to those agents, then they're ready for vaccine or therapy. Which of the following accomplishes microbial effects? Boiling, pasteurization, incineration, freezing, or desiccation? The best answer is boiling. So radiation, such as ionizing radiation, has a deep penetrating power. So we use this very sparingly. And the reason is because it actually can cause DNA breaks. And so examples of this are X-rays, cathode rays. We use this to sterilize medical equipment and sometimes food products. And so our ionizing radiation, you can see the radiation waves. And so the reason that it works out so well is the ionizing radiation is going to interact with whatever is rapidly replicating. And so in the case of our raspberries, the raspberries are already grown. And so what is actually rapidly replicating are any of the microbes that are on the surface of these raspberries. And so as a consequence, radiation then will specifically inhibit the growth of bacteria or fungi that are on the raspberry surface. And so that's how we are able to get raspberries, across the country and into the grocery stores in your homes by using ionizing radiation, which is going to cause DNA double-stranded breaks. Non-ionizing radiation is when you're using UV light. It creates pyrimidine dimers. Just as a reminder, pyrimidines are these here, so adenine and thymine. And so the pyrimidine dimers is when thymine has double bound. And so this interferes with replication. It causes mutations and limits the propagation of the contaminant. And so non-ionizing radiation is often used to sterilize air, water, various surfaces in the clinic. So if you have like a sterile surface, sometimes there's that UV light that you flip on to make sure that everything is completely sterilized. And so this is showing the UV lights shining on various water tubes and airflow in a much more industrial setting. Filtration takes place. So filtration is a lot like the process that you use to make coffee. You have a filter, and in this case you have a filter that is of a very, very small pore so that even a single coccus of bacteria could not pass. And we do this for various therapies that could not be exposed to heat or high temperatures. And so things that if you're trying to create a vaccine or what have you, that vaccine cannot be exposed to high temperatures. Instead, you could potentially filter out that and then be able to give that to the patient. Levels of germicide, so high all the way to low. Low, again, is vegetative cells and things like that. High are going to be endospores. There in the middle are pretty much the tubercle bacterias, the viruses, and things like that. So when you think about how we treat those, high-level germicides are used when you're going to open up a patient. So if you were going to perform a surgery, if something could not be autoclaved, you would expose it to a high-level germicide, such as the operating table. Intermediate level is when you have some exposure with mucosal membranes, and so in this case you're thinking of possibly the nasal tube for the oxygen. So it goes into the nares, so you'd want to make sure that that is very, very clean. And then, of course, low level, things that don't touch the skin. So you would think about the hospital bed being cleaned with a low level germicide. And again, the factors that control this are very logical in the sense that, what are you treating? How dirty is it? How long should you expose it? Can it sustain that level of exposure? Those sorts of things. And so alcohols, things like your hand sanitizers, often have about 70% alcohol in them. These are surfactants, so they're going to interact with the cell membrane, and they're going to push that cell membrane apart, and these are considered an intermediate level of decontamination. Iodine is a wonderful agent. It is still used in its various forms. Typically it's betadine now. And so iodine is also going to interact with the plasma membrane, but it is quite effective. It is low toxic levels, and so it is an antiseptic because it is being exposed to the patient's skin. Hydrogen peroxide, so this can be either an antiseptic or a sporicidal, and so the antiseptic level is about 3% that you can get at the drugstore versus sporicidal is about 30%, so big difference. And hydrogen peroxide creates very, very reactive free radicals. And so our skin, our red blood cells make catalase, bacteria make catalase, and so this toxic oxygen species must be decontaminated. And so in this case, there are lots of things that can't decontaminate that, and so it's going to kill any microbe that cannot detoxify oxygen. So in particular, that's going to be our anaerobes. Quaternary ammonia compounds. These are also surfactants that are used to treat usually inanimate objects, but not those that are going to touch the skin. So it's like a cleaner that you would use on the patient's bed. And then finally, our detergents and soaps are also a low-level cleaner. So you can see here, you know, if you have a germicide, it's a little more effective. Non-germicide, nah. And so this is parts per million per liter of scrub water. So this is just putting bacteria in scrub water and leaving it alone. Ultimately, because soaps, we mechanically use water and we rub our hands, that process is doing two things. You know, you're really moving off the bacteria from your hands as well as bursting open the membrane. So you really don't have to have a germicidal soap for that process. Personally, I recommend just something nice and gentle on your hands so that, you know, you're washing frequently and you're getting it off your skin, as opposed to the hand sanitizers. They're great in a pinch, but they're no replacement for good hand washing techniques as you go between patient rooms. So here's just an overall review of various cleaners, what they fall under. And then if you have any questions, please do reach out. The chapter is pretty straightforward for the most part. Make sure that you understand the chemical, what level of usage it is. So for example, if you say that you're talking about alcohol, so ethyl alcohol and its various concentrations, that is an intermediate level decontaminant. So kind of focus your information on that way. And also consider, where is it acting? So is it acting on the cell wall? Is it acting on the cell membrane? Is it denaturing proteins? Or is it impacting the cellular synthesis?